All right, guys, it is Thursday night, April 23rd. You guys will be seeing this morning, a Friday morning. It's about 11:15 in the evening, just for reference, because we'll go over some numbers as usual, and then get into one or two other items to touch on. Numbers for today, United States has 869,170 cases of COVID-19, and we're pushing 50,000 deaths, 49,954 deaths in the United States that have been attributed to COVID-19. Texas, we're still doing well. We've actually slipped a spot. We're in 11th now. Connecticut got past us, which is a race I'm absolutely willing to lose. So we're now 11th in the country in terms of number of cases, and with 22,650 and 604 deaths statewide. And Harris County has come up to 5,330 cases with 82 deaths. The city of Houston accounts for over 3,000 of those 5,300 cases. But in good news, city of Houston has not had a death attributed to COVID-19 in the last 4 days, I believe. So that's not certainly something that's a positive sign for Houston. So a couple things to touch on. First and foremost is going to be a facility that's set up down on the southeast side. And this is the first of these facilities. It may not be the last. The address is 9202 Gulf Freeway. And it is a facility set up jointly between the city and the county. And it is largely housing for specifically, the majority of people there are going to be homeless population who are COVID positive or suspected COVID positive, but don't have a place where they can go quarantine. They're not sick enough to be in the hospital, but they do have the disease or are suspected to have the disease. And so this is a joint facility. It's a Red Roof Inn that's been leased, and it's a joint venture between the county and the city. So for units that run the southeast side, or if you're on a debit day down there, if you get dispatched to that address, first of all, you'll probably notice something's up when you pull in. There's some fencing in the parking lot. There's a reasonably heavy law enforcement presence in terms of just securing the facility. Some things to know about that facility. As I said, those are all people who don't have somewhere else to quarantine. And many, if not all of them, are under a public health order, meaning that they have to stay there. Now, it gets a little interesting in terms of what the police can do to enforce that. But the bottom line is they're supposed to stay there. And to that end, there actually is medical staff there. They have access 24/7 to medical staff with, I don't believe it's a doctor on site all the time. I think it's at least a nurse on site at all times with a doctor available by phone. And so anytime that we go out there, we need to make sure the medical staff is aware of the process. All right. It's kind of like getting dispatched to a hospital in the sense of first thing to do when you get there is make sure that the nurses know what's going on. And so a lot of times they can resolve that. We've had multiple units get out there only to have their medical staff kind of say, oh, that we got this covered. Or, hey, you know what? He is sicker than we're going to handle here. This is not a medical facility. It's a Red Roof Inn. They just have a nurse available for kind of screening the patients. And if they have a headache or they have a mild symptoms, they can manage that there. They don't need to be going to the hospital. Okay. So keep that in mind if you're ever down that way, just so you know what that facility is. Make sure that anybody who you get now, if they're sick, if it's an arrest, something like that, certainly do our thing and make sure you notify the medical staff. But if it's a kind of minor call or something like that, especially if, from the notes or from talking to the patient, they called themselves as opposed to the medical staff at that facility calling, make sure you touch base with the medical staff to make sure that everybody's in the loop on it. The other thing to remember about that address is that everyone there is either known or suspected COVID-19 positive. So depending on whether the medical staff calls or the patient themselves call, the information may not get to dispatch. They may not trigger that IDA alert on the MDT, but if you're out there at 9202 Gulf Freeway at the Red Roof Inn, you should be wearing your PPE. because all of the people who are staying there under this process are going to be suspected or confirmed COVID positive. So keep that in mind as well if you respond out there. Again, that's the only facility of that kind right now, though if this continues to ramp up, if there's a surge as we start to reopen things, or if they need more capacity, they may open up another facility similar to that somewhere else in the city. So making you aware of that. The other thing real quick, you guys have seen a lot of videos, you've watched a whole bunch, you've got a ton of memos. Things have settled down a little bit from the new information perspective, but I just wanted to touch on PPE one more time. I know we've beat you guys up over the head with it, and you're pretty much experts on it now, but just as a review, obviously it's some kind of face covering at all times. So at the station, going to the grocery store, whatever, and that's on everybody because that's going to help minimize the transmission, especially if we do have asymptomatic members who are coming to work because they don't know that they're sick. In terms of patient care, minimum every call, every EMS run, eye protection, gloves. Anybody setting foot inside that 6-foot bubble with the patient, adding an N95 mask, not the surgical mask or the cloth mask or whatever it is you're wearing at the station, an N95. It's going to have much higher filtration and protect you in the setting that person is infected. And then finally, if you're doing an aerosol generating procedure, so NEBS, which should only be on medical direction order, CPAP, which should only be when you've kind of failed on the oxygen pathway and regular nasal cannula or non-rebreather hasn't worked. CPR, intubation, if ordered, no intubations unless the eye gel's not working or you're ordered by a medical director. Or if you're going to be up close and personal moving patients, really kind of body-to-body contact. And then those are the times you're going to add a gown. Additionally, you're going to add a gown for someone who screens positive for COVID. And you guys have heard about all kinds of atypical presentations and loss of smell and loss of taste and all that stuff. And those all can be COVID. But really, in this case, we're talking about the big symptoms, right? Somebody with a known exposure and respiratory symptoms or fever, somebody who doesn't have a known exposure, who's got respiratory symptoms and a fever, or obviously anybody who tells you I'm COVID positive or my doctor's got me quarantined for COVID. Those people you also want to add a gown to. And that's the basics on the PPE. Again, we've beaten this into your guys' heads. It's just a quick review because I know we haven't talked about it in the videos in probably a week or two. And just to remind everybody, especially that those masks that you're wearing at the station are not going to be appropriate for setting foot inside that 6-foot bubble. You need to be switching to an N95, put your station mask in your pocket, leave it on the apparatus, whatever it may be. You need to be switching it to an N95 when you're in that patient care zone in the compartment. Okay. Those are those are my updates for today. As always, if you guys have questions, if you have issues, I get a couple of emails a day from the field and I'm happy to respond. If I've missed an email, please just send me another email. I think I'm caught up. But I'm happy to respond to emails. If you have ideas for things you want to hear about in these videos, we're still doing 3 days a week as of this time. That might cut back in the future, but right now we're still there. So if you have ideas for videos, send them my way. Send me an email, Kevin Schulz, kevin.schulz@houstontx.gov. And as always, have a great shift, stay safe, and I'll talk to you guys later.